Autism, usually known as Autism Spectrum Disorder or ASD, is a complex disorder identified by communication and behavioral issues. It can exemplify itself in a wide range of symptoms and abilities. ASD might be a minor issue or a serious condition that necessitates full-time maintenance in a facility. Although there's typically nothing about people with ASD that distinguishes them from others in terms of appearance, they might communicate, participate, conduct, and learn in ways that are unique to them. Individuals with ASD have a wide range of cognitive, reasoning, and problem-solving abilities, ranging from gifted to severely impaired. Some people with ASD need a great undertaking of assistance in their daily life, while others need less. ASD is a complicated developmental disorder characterized by chronic difficulties with social communication, limited interests, and repetitive conduct. While autism is a lifelong illness, the degree to which this issue limits one's ability to operate differs from person to person with autism. Autism is a spectrum illness, which means that each person with autism has a blend of strengths and challenges. People with autism can learn, reason, and solve problems in a variety of ways, ranging from highly skilled to severely impaired. Rare individuals with ASD might require a great deal of assistance in their everyday lives, while others may require less assistance and in some circumstances live completely independently. ASD's diagnosis now encompasses autistic disorder, pervasive developmental disorder not otherwise specified, and Asperger's syndrome, which were previously diagnosed individually. All of these diseases are now referred to as Autism Spectrum Disorder, or ASD. What is it like to have an autism and deal with it? Sensory motor and tactile perceptions may be altered in people with ASD, resulting in heightened touch sense in some situations. This distorted perceptions might explain why children with ASD have higher pain prevalence than children without ASD. Parents of children with ASD are more likely to suffer from stress, depression, and anxiety, which may influence how they report symptoms on behalf of their children, particularly those related to emotional and/or painful experiences. Previous research has also found that children with chronic abdominal pain report more pain when their parents are worried or have anxiety-like symptoms. As a result, when looking into the prevalence of pain in children with and without ASD, parent mental health problems may be a significant aspect to consider. Some of the observed pain variation could be attributed to the influence of parent mental health problems on the children's perceptions of their experiences. Autism affects children differently than it affects others. Autism has considerable detrimental influence on household and parental well-being due to its basic characteristics, related symptoms, and behavioral issues. Their parents face a variety of obstacles as a result of their children's communication and social abilities problems, as well as the behaviors they exhibit. This caused parents to live in a life of chronic melancholy and depression, resulting in negative attitudes and self-blame rather than a positive outlook on life. Research has revealed as well the enormous challenges faced by people with autism in their families. Also, the parental well-being effects, including emotional stress, the binding financial pressure of constant medications and therapies, the crucial burden of family relationships, alteration in family roles, structure, and recreations, and feeling of guilt and fault as a result of the diagnosis, as well as social stigma. Autistic individuals may behave differently than others. For instance, it's difficult for them to comprehend what other people are thinking or feeling. Bright lights and loud noises can be overpowering, distressing, or uncomfortable for them. Unfamiliar surroundings and social events distress them. They take more time to comprehend their thoughts, find it difficult for them to speak and interact with others. What individuals can do to recover from it? Autism has no known cure, according to the majority of experts. That's why many of them take a holistic approach to ASD, focusing on symptom management as well as skill development and support, which might include behavioral, psychological, and educational therapy. Moreover, autistic disorder recovery is uncommon. After a few years of therapeutic effort, there are few examples of autistic disorder recovery. Healthcare providers who treat ASD, on the other hand, agree that beginning supportive therapy as soon as possible is critical. People with autism face many challenges throughout life. How do people with OCD cope with it? Watch it to figure it out.